when it comes to heel pain, selecting the right shoe depends on why your heel pain is present. And it's not the same with every person. There are a lot of factors that can drive heel pain, and that's why we don't treat it all the same way. Is your trendy minimalist shoe actually keeping you in pain? It's a good question. I love the idea of intrinsic foot strengthening as a podiatrist, but for my patients that are in acute or active heel pain, this is often a right tool, wrong time type of scenario. Today, I'm going to show you 3 shoe mistakes that keep people in my office needing treatment, specifically runners, and how to pick the right shoe type for you. My name is Dr. James Repko. I'm a board-certified podiatrist. I practice at Bayshore Podiatry Center in Tampa, Florida. So here's the thing with minimalist shoes. They work. They're supposed to strengthen the intrinsic muscles of your foot. All of this stuff, okay? I love that idea as a podiatrist. It's great, and it's often a part of what needs to occur and part of a treatment plan for somebody with plantar fasciitis. But the idea of walking barefoot or using minimalist shoes while you have an active flare going on is, in my opinion, a recipe for more pain and not resolution. Now, while it can work for people, it may work in an acute setting, but really what's happening and what you're doing, and what I consider it is, you're adding insult to injury. You're asking structures to work while they're already not working, and you're further overloading your plantar fascia if you have plantar fasciitis when you're walking barefoot or using minimalist shoes. Going from a supportive shoe to a zero drop or minimalist shoe can be a huge training spike as well. And I think that you have to appropriately transition, just like you wouldn't get up one day and decide, hey, I haven't run in 10 years, but I'm going to run a marathon today. Probably a recipe for some type of injury, right? It's no different with minimalist shoes, as well as the trend of these zero drop shoes. While I do like zero drop shoes and I'm often seen wearing them in clinic, I think there's a transition period of how you need to get into that. And the idea behind them is great. When is it not the time to use them? Not a great time to use them whenever you have acute heel pain, because it puts more stress and strain on the intrinsic muscles of your feet as well as your plantar fascia. My rule of thumb for these types of shoes for my patients as a general guideline is, if you have acute heel pain, minimalist shoe is something that we implement later and we gradually implement. There's something that have to be earned to wear, in my opinion. They're not for everybody. And you can't just all of a sudden decide, hey, I'm going all natural and expect that you're not going to have problems. Now, on the other hand, what I see is people think that more cushion equals more stability. That is not the case. I think with acute heel pain, cushion initially helps because it provides some shock absorption. Cushion can also, when it's really thick, it can fill your arch and act like a bit of an orthotic whenever your foot compresses down. So you can cushion the arch heel and you can cushion your heel as well as the ball of your foot. So while it's a good tool, it's not a solve-all. And the thing is, depending on what the density of that foam is, it can increase the instability in the frontal plane as well as sagittal plane up and down, which increases the load and the demand on the foot, which is causing heel pain in the first place. And it can certainly, if it is not dense enough in the right places, it can lead to pronation, inward turn of the foot, which is going to tension your plantar fascia on the bottom of your foot as you turn in and push off. Comfort matters, but stability matters too. So it's not an absolute between maximum cushion is the right thing for plantar fasciitis or minimalist shoe gear is right for plantar fasciitis. This leads to the third mistake that people make when buying shoes. They don't understand what's driving it, what's driving their pain, and what shoes they should necessarily get. So when people ask me for shoe gear recommendations, which is one of the most common things that I get, I'm looking at things from a comprehensive perspective. I think comfort is critical, but I also look at shoes as though they are non-prescriptive devices. Now, there are features of shoes that I think are very important, but that depends on the individual and what they have going on. So in clinic, I'm looking at x-rays and foot structure, both from an osseous bony standpoint with your x-ray, but also your standing and how your foot moves. I'm looking at your ankle mobility, where you're tender, and your gait pattern, and that is going to lead to what type of shoe that I'm going to recommend for you ultimately. When it comes to heel pain, selecting the right shoe depends on why your heel pain is present, and it's not the same with every person. There are a lot of factors that can drive heel pain, and that's why we don't treat it all the same way. So how do you know if a shoe is right for you without an evaluation? My rule of thumb is you're walking in your shoes and they're causing pain that is greater than 3 out of 10, it's not the right shoe for you at that time. If you can get away with wearing minimalist shoes and you have heel pain and your pain's not getting above 3 out of 10, that's great. You can continue doing that, and I would encourage you to do that. It will likely help your heel pain, but if it's causing more pain, then you need to stop. I kind of look at it as like a ladder type of treatment. If those shoes or certain shoes are causing that greater than 3 out of 10 pain, we look at this as like the flare phase, where we want more supportive shoes. From a sneaker perspective, I would say Brooks Adrenaline GTS, Hoka, Arahi is a more stable and supportive shoe that I like. The Nike Structure is a good supportive shoe. Asics has their staple Gel Kayano, which is just a great shoe and it's very supportive. Sometimes you don't need all that structure and support. Those are on the more supportive end of things, to think if you have hyperpronation or overpronation or flat foot issues. If you are in the acute flare phase and you have maybe more of a neutral or a high arched and stiff foot, you might want something a little bit more cushioned or springy shoe like Nike Vomero Plus and Asics Gel Cumulus. I also like the Brooks Glycerin, or the Brooks Ghost is a good one. Some people really like the On Clouds, but I never got the hype behind that. They don't feel comfortable on my foot, but they're fine shoes by all means. They work for you, so I'm not as familiar with their lineup. Shoes that I would avoid at this time, you need to try it. And I'm not saying that they're necessarily bad, or things with less of a heel to toe drop. So when we talk about heel to toe drop or zero drop shoes, we're talking about the stack height of the foam underneath the heel to the stack height under the forefoot. So I'm going to turn around and grab an example here. This, which is an Ultra. Now this shoe has zero heel to toe drop in the forefoot. It does have a lot of cushion to it, which can act like an orthotic. If you have a tight ankle, this shoe can actually exacerbate your heel pain. And it may be something where you want to transition to something like, this is my new favorite shoe. Actually, the shoe saved my feet in a recent race. This is the Nike Vomero Plus. This has a 10 millimeter differential from the heel height back here to the forefoot drop up here, which lifts your heel up and takes tension off your fascia and your Achilles, makes them work not as hard. It also has a ton of foam to it. It's a pretty stable shoe. It might not be the best shoe for somebody with a flat foot, but if you have a neutral or high arch foot, that might work well for you, especially if your ankle joint is stiff. And honestly, people with high arched feet, they tend to have very tight ankle joints. So that's a great shoe for them. That Ultra that I just showed is a model called the Paradigm, and it's actually a stability shoe. It might be good for somebody with a flat foot. Ultimately, you need to go and try these things on and see how they feel. Most good shoe stores at this point have a good return policy. Most online shoe stores have a really good return policy. I'm currently a fan of the Topo lineup of shoes, which is a lesser known brand because it has a wide forefoot. I like that. I think it allows me to better engage with the ground, and it doesn't have too high of a stack height. It's 5 to 0 in the forefoot, but I'm not an absolutist when it comes to shoes. I think that it's important that you go and try things on, that you need to see how they feel for your foot and be able to return them as well. Some important things to look for in shoes. I think that the ability to remove an insole is important in case that you would need to put an orthotic in there eventually for your heel pain. Some shoes come with them glued in or sewed in, and you can't do that, and the shoe becomes too tight, you can't use it. Another thing to look at from a stability standpoint is the heel counter and pressure issue. This, not being able to twist back here, does provide some structural support. You can see that the shoe doesn't have a lot of torsion to it as well. That means that the shoe's a lot more stable versus another example here. You see this shoe has almost none. This is another Ultra, and it is super twisty and bendy. Not a very stable shoe. This shoe, the Ultra Escalante. You see the shape in the forefoot there, how it's wider. I do like that. It's a shoe of mine, obviously, but not something that I would recommend for somebody with acute plantar fasciitis or stability issues. Again, going back to that former Ultra paradigm, you could see less torsional give there. And again, a good heel counter there as well. A lot of times shoe will say, if you want a stability shoe, it'll say guide rail or something firm here on the inside of the shoe. So those are some features that I really look at. I also don't like to compress the forefoot. Like I said, with the Ultras, they have this very wide forefoot, and even the Nike isn't bad, like I said. Well, not a bad shoe necessarily. You see the difference in this Asics model, how tight and narrow that is. Not always a bad thing, but a feature that I try to avoid in people with plantar fasciitis, or especially if you have pain in the ball of your foot. But this, again, a good shoe, doesn't have a lot of bend to it. Not bad. A good buy from a shoe perspective. The Asics GT 2000, it's a staple. They have a little bit of gel in the heel, and it's a nice shoe for plantar fasciitis as well. I try not to judge a shoe by 30 seconds in the store. Wear it around your house, see what it feels for a couple hours, and see how your foot feels in the morning the next day. I think that's really important to do. So a good return policy is critical, and a lot of places, like I said, will have them. So if you're thinking about minimalist shoes, think about it this way. You're not going to walk into a gym and be able to squat 500 pounds on day one. So don't expect to be able to wear minimalist shoes all day, every day, right from the start if you're transitioning from traditional shoes. Just like you don't want to bench press if your shoulder hurts, you don't want to load your foot too much if your heel hurts. If you want a deeper look at specific brands and specific shoe recommendations, I'm linking in the description below our shoe guide for heel pain that I spent an extensive amount of time on, and it's a resource that we keep updated annually that you can reference and check it out.